Another very interesting event with Indo-Indians. This is Poonam Sagar, and our topic today is Ozempic versus diet. What's actually healthy? Weight loss drugs are everywhere right now, but are they the answer or just a shortcut? Join us for a real no hype conversation with Dr. Varkha and nutritionist Geeta Seth on what actually supports long-term health. What we will discuss is Ozempic, what it is, what it does, what it doesn't do, diet, lifestyle, and sustainable health, quick fixes versus long term results, and how to make informed choices for your body. I have with me today our distinguished speakers, Dr. Varkha Lachman. Hello, Dr. Varkha.
Hi. Hi, everyone.
And I have our diabetes specialist and nutritionist, Geeta Seth, also with
Hi
us.
everyone.
I would also like to give a very short intro to both our speakers. Dr. Varkha is a general practitioner at our Rumasakit Bunda Hospital. She is graduated from Atmajaya University and has been practicing medicine since 1996. She also has a diploma in family medicine from Apollo Hospital, India, and is international member of Royal College of Physicians. Dr. Varkha has a graduate diploma in family medicine, dermatology from National University of Singapore, and in 2018 acquired the certificate of knowledge in clinical tropical medicine and travelers health. She is currently also involved in a lot of occupational health for corporate projects here in Indonesia. Geeta Seth is a qualified nutritionist.
Poonam, you are less audible.
I'm less audible. Oh, I'm so sorry. I'll try to be speak louder. Geeta Seth is a qualified nutritionist and dietitian for the past 15 years. I think more, yeah, Geeta?
I think 20, now it's 22 years.
22 years.
Yeah.
A 2 times gold medalist in the field of nutrition. She is also a qualified diabetes educator and a diabetes pump trainer specializing in the field of diabetes. She claims to have a normal blood glucose in diabetes with the right diet to avoid diabetes complications further. Also, with the right carbohydrate counting for type 1 diabetes according to their dose, she gives the accurate diet to achieve normal glucose in the blood. Geeta has worked for various health institutes and hospitals, and as a speaker, she has given nutritional services to various corporate institutes and schools. So, welcome everyone. I'm so excited to have all of you here with me, and it is really a pleasure to have you, and I'm so grateful that all of you are here with me. I'd like to start this session by asking both of you this question. Ozempic has moved from a diabetes drug to a mainstream weight loss trend. Why do you think this shift has happened so fast? And what are the people most confused about today? Over to both of you.
Right. Sure. So, what is this Ozempic and Wegovy? Actually, we have two brands available now locally, which is the Ozempic and the Wegovy. Both contains exact same content, which is the semaglutide, which we actually consider as the glucagon-like peptide 1 receptor agonist. So, what does this glucagon does? We all normal human beings do have this glucagon in our system. So the glucagon is actually balanced in everyone's system. But the semaglutide, which is a glucagon-like peptide, when we inject it to ourselves, it actually increases the glucose-dependent insulin secretion. So there is an increased insulin secretion. That's why it's actually used for diabetic patients or pre-diabetic patients. However, it also, because of this medication, it also can cause a slowing down of the gastric emptying. And it's so potent that it can also work in the brain, regulating the appetite and the calorie intake. Therefore, this drug actually has been very effective in losing weight because of its big character in the brain, regulating the appetite and the calorie intake. So initially, yes, it was used more for diabetes, but because of these two other impacts that an individual can experience, therefore they came up with a similar medication but a different brand name by the name of Wegovy, which is actually used for losing weight.
Right. So thank you for that explanation, Dr. Varkha. It's very interesting how they have rebranded a drug from a diabetic use to weight loss use, like you just mentioned. So, Geeta, what is your view on this?
So, as a nutritionist, I know one thing. We eat food, it goes into our stomach, into the gut, and then the gut has this hormone called glucagon like peptide 1. What does this do? This slows your digestion, as Dr. Varkha said. It slows everything in the sense that your glucose will not go up and your everything is going to slow down. But in regular humans, what happens that we use this hormone, the gut is using it, and the moment you empty your stomach, again you feel hungry. You want to eat food. Then we let's not get into binge eating and everything. The moment this process slows down, I just want to tell everyone in a very simple way, this glucagon like peptide or gut hormone is actually slowing everything in the body. But when you give it from outside in the form of Ozempic injections, right? So it further slows everything, and you feel all the time your stomach is full. The moment you have the feeling of fullness, you will not eat it. This is the way the Ozempic works initially. We'll come to more, but this is how it works initially. So slower gastric emptying, well, it can be done by foods also, but it has its limitation. When people are extremely overweight, we should use Ozempic. Because it is actually slows, very makes it very slow, making us feeling very full and content, and there is no need for more food. This kind of feeling comes when you take Ozempic. If you are not worrying about how you eat, what you eat, so then the outside source helps us. Please
Right.
continue.
So I'm very, now we see everywhere on Instagram, we see the Ozempic phase. We see celebrities taking Ozempic. You go to YouTube, you hear everybody talking about Ozempic. So, Dr. Varka, why are doctors prescribing Ozempic to overweight patients? When does excess weight become a medical issue that justifies medication?
So we are still using the BMI, which is the body mass index, which is calculating the body mass index is based on your weight and your height.
Right.
So based on the body mass index, ideally for obesity, if you are above 30 milligram per kilogram, if you are above 30 kilogram per meter square in your BMI,
Yeah.
then that has increased risk for morbidity, including a heart condition issue, a blockage, a stroke issue. So it definitely increases your risk if your BMI is 30 or above. However, if you already have an underlying medical condition, if you already have a hypertension, if you're already known to have chronic blockages in your heart vessels, then we reduce this BMI index. So we reduce the BMI index to 27 kilogram per meter square. So actually, the indication for starting this Ozempic or Wegovy is if your BMI is above 30 kilogram per meter square without any underlying medical condition, or if your BMI is above 27 kilogram per meter square with an underlying medical indication. This is to prevent you from getting the complications of these conditions, of these chronic medical conditions.
Right.
So less than 27 kilogram per meter square, like actually, overweight is 24 to 25 BMI. So we don't start it at that time because we believe that if you are still below 27, your lifestyle changes, your dietary modifications, your exercise activities will help. So there's no indication to start this medication unless your BMI is, as I mentioned, above 30 without any underlying medical condition, or above 27 with an underlying medical condition.
Right. So Dr. Varkha, I understand what you're saying, that if your BMI is higher than 27, then maybe you are a case for taking Ozempic. I'd like to move this question to Geeta and ask her that, Geeta, as a diabetes educator and somebody who understands this being a dietitian, nutritionist, is it fair to think of Ozempic as a lifestyle medicine like blood pressure or diabetes tablets? Where should doctors draw the line?
Okay, so one very simple thing we understand, as Dr. Varkha also said, when the BMI is higher than 27, then you come into the obesity grade. Then there is obesity 1, obesity 2 grade, and the third grade. So for a person who's slightly overweight, if he checks himself 4, 5, 6 kgs of overweight, then the diet perfectly works. And then you are away from these diseases also. But suppose if somebody is overweight by, 25 kilos and above, that means the metabolic syndrome is going to happen. What is metabolic syndrome? It is you have blood pressure, you have cholesterol issues, you have diabetes. These three things together, they form metabolic issue. Now, for such people, the doctors immediately put them on the medication like Ozempic. Why? Because the first thing is that they should be away from these diseases. Now, obesity, if it is slightly being overweight, not an issue. But the moment it has gone up above than 20, then the side effects of Ozempic are, let's not talk about them. Otherwise, the metabolic syndrome is only going to kill them. They will be very sick only by having high blood pressure, only by having high diabetes, all three together, including the cholesterol. Then how will they manage? We are seeing now, I'm seeing my patients who are really, really obese. They have no other thing. So for them, Ozempic is actually a very nice thing. Of course, they have to take under the prescription of doctor. We'll see the pros and cons. But Ozempic really works when somebody is morbidly obese. That is something we should look after it.
Right. So, Dr. Varkha, if taken in small doses under a doctor's supervision, how safe is Ozempic for long-term use? What do we know and what is still uncertain?
Okay. So Ozempic is a relatively new drug, I would say, but very, very effective. However, we are certainly seeing a lot of adverse reactions with it. So it actually doesn't matter on the dosage, because every individual would react differently towards this glucagon-like peptide.
Right.
So unfortunately, as I mentioned, this GLP-1, they actually increase the insulin secretion. So if you have a lot of sensitivity towards the insulin that's secreted, your sugar levels definitely go significantly down irrespective. So that is the reason why we actually start at a very low dose and we have the body adapt to it before we continuously increase the dose to the maximum dosage.
Right.
So we usually start at a 0.25. Again, it depends on either it's Wegovy or Ozempic, because they have both different dosages at the moment. So either or. So we start slow, giving it a month for the body to adapt to it. And we increase the dose every month until we reach the maximum dose. Because the body also needs to get adapted to the insulin that's secreted, which is also breaking down the sugar, which can increase the likelihood of developing some symptoms of the hypoglycemia impact.
So,
Yeah.
Dr. Varkha, do you prescribe Ozempic to your patients?
I do prescribe Ozempic to my patients. I've got a lot of patients on Ozempic, especially in my American population. So I can say like 20% of my American population are on Ozempic. So honestly speaking, like I got really tempted with this Ozempic drug because I see a big difference in my American patients. So I honestly did try Ozempic myself because I did qualify for it in regards to my BMI and my underlying medical condition. I did a 0.25 milligrams, which is an extremely low dose of it, which actually did knock me off. So I kept burping, my acidity issues, my the reduced intestinal movement, the gastric emptying was so significant that like it just made me uncomfortable. So I tried to adapt with it for in fact I did for 6 weeks, and then I thought I was adapting to it, but when I increased to the zero point 0.5, it knocked me off completely. I developed all the side effects of this hypoglycemia. I was literally not able to come out of bed.
Oh,
So it doesn't matter on the dosage that an individual is using. It just depends on the reaction of the medication to the individual. So yes, we have to be extremely cautious about it. And I always tell the patients about what to expect using it. And at the end of the day, it is the patient's preference and the patient's choice. But we are always open to these adverse reactions to the patient.
no, absolutely. And I think I must thank you that you shared your own experience online, that you have taken Ozempic and your personal experience. It has so much, authenticity that for you to be able to share that and for all of us to learn from your experience, what better way than to learn from you, Doctor? Thank you so much. So when you mentioned that you kept burping and you went into a hypoglycemic mode, that's terrible. So you must have felt so weak and not able to function normally.
Yeah, yeah, I took off literally that day, like that. So the peak of this Ozempic is usually at around 2 to 3 days. So you can actually know that as well. So I kept seeing a pattern that every 3 days I would definitely take a day off work.
Oh
So
my.
I knew that things was not right. And so I actually honestly wanted to try it because of the success.
Hmm.
And, like that gives me the ability to talk to my patients about what to expect.
Okay.
But it literally was by the scientific research. Every 3 days you would notice these reactions and it will gradually fade off. So again, it depends on if you are willing to take this effects or not to yourself.
Right. So did you lose weight?
Oh, I did. I did. Over the first month, I was able to lose at least 2.5 to 3 kgs. So
Right.
it was really a good result, where, like people would be tempted to continue on with it. But
Did you
again, you
gain
need
it
to
all
know your
back?
priorities.
Sorry. Did you gain it all back after you stopped?
Uh, so it depends. So yes, if you don't continue with your lifestyle modification. So the main reason to start on the Ozempic is actually to simultaneously go hand in hand with the dietary changes and the the exercise that you need to do. Because if you actually just do the Ozempic without changing your lifestyle, without like modifying your diet, because because of the reduced gastric motility, the gastric movement in your intestine, you have to be very selective in the food that you eat.
Mm.
Because if you do not eat the nutritious food when your stomach can only take a small amount of food, you tend to actually reduce your muscle weight as well. So your muscle mass reduces if you do not take a high protein in your diet. So that's also one of the adverse reaction of this Ozempic, but it reduces your muscle mass. So you have to be really cautious in the diet that you take. You need to have a high protein diet to maintain it. Plus, you need to do your physical activity. So the Ozempic is actually an adjunctive to that, because by the time you have lost a lot of weight, your intestine has actually gone a little smaller. So you would not, that would change your lifestyle overall. And you also have to do your exercise to build your muscles. Otherwise, you will straight away gain back your weight that you lose.
Right.
So if you can work hand in hand with that, then it is effective because you
Right.
later have to taper it down again.
You should have worked with Geeta. You should have worked with Geeta to give you the right diet, the nutrition to
So yes,
sustain yourself.
I'm happy to know that Dr. Varkha has used it herself. I didn't
Yes,
know
I
this.
tried it. I tried it to be a
So
part
that's
of
really
what
nice.
patient can say.
So Poonam, I want to tell you something.
Geeta,
So
I
Poonam,
think,
I want to tell you something.
yes, please.
Whenever somebody comes for a diet, am I, am I audible, please?
You're audible, but I
Yeah.
think your
So
internet
Poonam,
connection
when
is
somebody
not.
comes to me or comes to us for a diet, then what they have to do? Choose, it's fine.
Your Yes, you're fine. Your network bandwidth is low, it says.
Maybe.
Yeah,
I think how
it's
to help
fine.
it.
Please go ahead.
Yeah, okay. Can I go ahead?
Yes, please.
Yeah. So tell me one thing that when somebody comes to us for a diet, we tell them, okay, you'll get thin, remove all the fats from the food, remove all the sweet from the food, and you have high protein and high fiber diet. Am I audible?
Yes, yes, absolutely. If you remove all your fat,
Yeah,
if you
okay.
remove all the
So we
carbohydrate and sugar, you will lose weight.
Yeah. So we tell them, we tell them all this. I think everybody knows these days that you should have less of carbs, etc., etc. Now the thing with Ozempic is that many of them think it's a magic pill or it's a magic injection because it immediately lowers your fat. That's true. Some people have a better face, some people have a lesser or higher face. But I think something is wrong with the
It's fine, Geeta. Please continue. You're fine.
okay, okay. Sorry. Yeah. So, people just think that it's like a magic. You just take it and you become so thin. As you have seen the great celebrities, they have just reduced like anything, especially people have lost 30, 40, still more also with Ozempic diet. Remember one thing, whether you are on an Ozempic diet or not, this is definitely that one should have only high protein food. One cannot have high carbohydrates because since the gastric emptying is slow, it is going to further give you issues like vomiting sensation or not feel you don't feel good sensation because the carbs are going to now reduce. They go through the digestion process where the gases increase because we are having high carbs. Some people think, okay, if I'm on Ozempic, let me have whatever I like to have, let me have that. You cannot have it at all because you will have a lot of side effects. And remember one thing, when you are on Ozempic, you lose much more protein than expected. When we are on a normal diet, you don't lose much of protein. That's why they call it Ozempic faces. Your face just goes, reduces the muscle mass, and you start looking older. That is a very big minus point of Ozempic. So, when on Ozempic, you have to exercise well and you have to definitely take per kg body gram per kg protein weight for 1 gram for 1 kilo. This you have to take care. Sometimes you need more also. Sometimes you need more also because otherwise you are going to look older. No doubt you are going to look thinner, but you're going to look older also.
Correct. So, Geeta, I have a question. Does rapid drug led weight loss give the same metabolic and nutritional benefits as food led, lifestyle based weight loss, especially for diabetics and pre diabetics?
Definitely, this glucagon like peptide one works on the body so well that it is actually a boon for diabetics. People who have high sugars and the consequences of high sugars, then they don't have to deal with this. So it's a life savior. When it comes to diabetes, it is a life savior. And at the same time, when you reduce your weight, your blood glucose becomes better. So it really really is good for people who really have high diabetes and who have got lots of body weight. It's actually a boom, but yes, one has to deal from person to person, one has to deal with the consequences maybe the doctors and your team will prescribe you high intensity workout, which really have helped in Ozempic. When you have high intensity workouts in the sense weight training, then your muscle mass increases. And when you take more protein, then your muscle mass increases. And then you are losing fats, not the muscle. But when you are simply on an Ozempic diet, then you will lose fat as well as muscle. So you are going to not come out with a better condition, definitely.
Right. Thank you, Geeta. I'd like to ask Dr. Varkha a question about the Ozempic face. We see on Instagram there are these celebrities and everybody will say, and they'll put hashtag Ozempic face. What does that mean?
So yes, as Geeta had mentioned, the Ozempic phase is when your muscle mass reduced, even in your face. So it's basically in your entire body.
Right.
So I always tell my patients to actually get their fat and muscle mass index measured initially
Mm-hmm.
and to start on the Ozempic just to make sure that, like on a monthly basis, they're not losing their muscle mass significantly because of this impact. So
I
if
see.
they're not doing a balance of their protein intake and their weight exercises, I have seen patients where their muscle mass drastically reduced.
Mm-hmm.
And that is not the impact that we want. So, by working hand in hand with the lifestyle changes, actually, we can prevent this Ozempic phases. So, this Ozempic phases was actually a hashtag that was taken like earlier on when it just started, when the Ozempic was just there. That's why we saw this Ozempic phases. But science has definitely learned more about it. And now, if we do it properly under the supervision, we can actually prevent all these, a lot of these muscle loss that we see.
I hear both of you. Both of you are saying the same thing. You're talking about, high protein, you're talking about high fiber, you're talking about exercise. And I hear that, if you are looking after yourself through your lifestyle, you will in any way be healthier. But let's talk about people who have, for some reason, unable to exercise. For people who may have hurt their back, or because of some other predisposing conditions, are unable to exercise. And look at the Indian diet. Our Indian diet is mostly carbs. We try to eat protein. It is a challenge to get that 1 gram per body weight, per kilo of body weight protein. That's a lot. So if I weigh 60 kilos, that means I have to eat 60 grams of protein every day. It's not
What to do?
easy.
You have to put it, Poonam, because in case you want to be fit and you want to look younger and you want to look leaner, it is a challenge. But this challenge has now started being meeting, because now instead of the normal yogurt, they are taking Greek yogurt. Every day you have cottage cheese, or at the same time you can have eggs for non-veg. But remember one thing: whenever you have high protein, you must have high fiber and good water content in your body also. Sometimes people are only on protein, and what happens there, if they are only on protein, they just increase their uric acid also many a times, especially the protein powders. So it is a challenge, but it can be met, and people who meet with this challenge, it's not as difficult. No doubt our Indian diet is not high on protein many a times, because we are carb based people basically, but it can easily work.
Right.
And when you said, Poonam, am I audible, please?
Yes. Yes, you are
Yeah.
audible.
So when you said, Poonam, just now when you explained, oh, one should have a high protein, one should have high fiber, one should have this, and one should do exercise, aren't you talking about a normal person doing it? So please remember, Ozempic is no magic. It will be a magic for some time, and again you will regain back your weight. This we
Right.
have seen that moment many a times. Moment you leave Ozempic without asking your doctor, without seeing the doses, you should taper the doses. It will come back. In fact, it will come back more.
I
But if
agree,
you take a
Geeta.
good lifestyle, if
Yeah.
you have the correct diet, then it is not going to have any problem.
So I
Mhm.
have this question for both of you. Weight loss often brings better sugar levels, better blood pressure. of
100%.
ability
That
and
is true.
confidence. In your view,
Correct.
when does weight loss truly translate into better health and when it might not? Now, I'm not saying diet or Ozempic, but we know that sometimes weight loss can give you better blood pressure results, better sugar levels. You even go for a you go to the you go to your gym and you ask to do your chronological age versus metabolic age, and when you lose weight, your metabolic age also decreases. So, you know, does that say that if you are morbidly obese, this is the easy way to lose weight and get your vitals
Not
under
not
control?
only easy way, but actually a good way. Because if you are morbidly obese, then you are not left with anything else. For them, I feel Ozempic is a boon. But provided you are getting along with your whole team who can help you exercise, who can help you give you the right diet, believe me, it's a boon. It's a good thing for morbidly obese people.
What do you say, Dr. Varkha?
So, talking about when weight loss is actually more injurious than healthy
Mm.
is when you lose your weight, losing your muscle mass. So you're actually not reducing your fat mass, but you're losing your muscle mass. That can actually cause more harm to you than benefit
Mm.
because you actually are weaker. You are prone to more injuries. So that's when it is a little bit challenging when you consider weight loss as being unhealthy. So I usually do not only base it on weight, and I do simultaneously go by the fat and body mass index. That's actually what we are utilizing now more compared to the weight and the BMI.
So, if someone asks you directly, should I choose Ozempic or diet? How would each of you answer? Dr. Varkha, maybe you can
I
answer
would
first.
go based on the indication. So if they are morbidly obese or if they have underlying medical condition, I would recommend them to go simultaneously.
Mm.
So besides the medication, also the lifestyle changes, because at one point of time, we do want to rely on their lifestyle changes and reduce the medication effect. So medication is just like a supporting system towards their lifestyle changes.
So, do you have to take Ozempic lifelong?
No, you don't. If your lifestyle works, you can taper off your Ozempic. And I've seen those cases as well.
Right.
And
Geeta?
unfortunately, being on the highest dose of the Ozempic for a long duration of time has its own complications. So
Oh,
it can even in 1%. So now this is a new thing that they have actually identified, although it's not common, but we are seeing a sudden vision loss with
oh my
being on
God.
Ozempic on a long duration for a high dose. So, with that experience, we usually tell our patients that we do not want them to be on it lifetime. So, our target is actually to taper the Ozempic when their lifestyle is ready and when they are ready to have it, to have it reduced. And we don't want to use it for a long term. And in fact, most of my patients do have the fear of that loss of vision, and as a result, they themselves initiatively would lean towards the lifestyle changes.
I think that's a very valid point. I think I didn't even know about this vision loss.
Hmm.
Geeta,
And
what
Dr.
so
is
they,
your
Dr.
view?
Varka, Dr.
sorry,
Varka,
go
have
ahead.
you seen your patients bring back their weight
Uh,
once
re,
they are off?
re, re, with, yes, I have. Yes, I have. So in fact, the guideline for this Ozempic and for this Wegovy is if they do not lose the at least 5% of their weight with these medications, we actually have to discontinue it because it's not effective for that individual. It's not working.
Right.
So yes, there are those guidelines, and yes, I have seen my Caucasian patients when they have reached their target, we actually taper it down. It's a slower taper. It's not like a monthly. We may have to go for a couple of months. Again, it depends on how much they have embraced their lifestyle changes.
Right. So, Geeta,
So,
how would
Dr.
you
Varka,
answer
also,
if
Dr. Varka,
somebody
I would
asks?
like to ask, once the person loses enough weight, then they are away from their metabolic syndromes,
Yes,
their blood
correct.
pressure, their diabetes, their lipids. Do they come back to normal for a better life?
We have reduced their medications, but again, we are still jittery to take them off completely from it. So they are on the lowest dose.
Geeta, with all this answer and all this information and all your knowledge, if somebody asks you directly, should I choose Ozempic or diet? How would you answer?
See, if somebody comes to me, I would see that how fat the person is. If the person's weight should be 60 kilos and the person is 90 plus, then I would definitely tell him, please go on it. Of course, under a doctor's guidance, because this is a drug you cannot just prescribe. And and you have to see all the time, you have to observe the patient. If the person is some 5, 6, 7, 8 kilos overweight, then simply understand that if they have come for Ozempic, they just want that small magic to happen overnight. This is what they expect. And as we see the celebrities also, they look better and we don't know what they have gone through. They look better and, they feel, they as if they are the promoters. Of course, they are not. And they become the promoters. But if somebody is morbidly obese, then one should go because so fat and dealing its complications is then Ozempic is much better to deal with how to do what to do. If you do use this drug with care, believe me, it works. But if you are not, if you are wanting only magic overnight, then nothing will work. Then nothing will work. Like Poonam, you said that one should do this, wine on a diet. In same way, in Ozempic also, he has to take care of everything. You just cannot eat a cake, pastry, and it should be in your stomach for a longer time, making you feel full. Then what about the gases, the gastrics issues? You're going to deal with it. So in any case, remember, every person has to do with the right diet. No doubt the magic happens,
Elderly
but
patients? What about elderly people who are overweight? What about elderly people with lower mobility and
see,
they are unable to exercise and
see, elderly,
they are overweight? What would your advice be?
you're asking me?
Yes, for an
Yeah,
elderly
sorry,
patient who
because the
cannot
band is
exercise.
anyway. So when there are elderly people, remember one thing that they cannot do physical activity.
Yes.
Their physical activity limits, but they are obese because of their previous lifestyles. Then they have to take Ozempic for sure. But yeah, this is true that the Ozempic is going to give you a lack of muscle mass for sure, and it then definitely looks wise also you're going to be thin, but you're not going to stay look great with it. I mean, everybody's obsessed in looking good. Why they want to become thin? Because they want to look good, but they don't want to be called that, oh, you look thin but you look so old. That is not the correct approach. So a high protein diet for such people, especially the elderly, is very, very vital. All your body, everything requires protein, everything requires protein. And in any case, we Indians, we have low protein diet. And at the same time, if you take Ozempic, then the remaining protein also goes. I'm just talking in a nutshell. I'm not talking about person to person. Elderlies who are really obese and they are going through so many things, Ozempic has actually helped a lot in the heart conditions also. It's
Right.
supposed to be a boon for heart diseases. I mean, I'm sitting fat and I'm very obese, and tomorrow I have heart problems or blood pressure or blood glucose. But I say, no, no, I don't take Ozempic. I don't take anything artificial. I'm very happy to be the way I am. That is not correct. That is not correct because you have to remove your metabolic syndromes. Then only it's going to work well.
Your
I think
viewpoint, Dr. Varkha, what do
So
you
I
think?
actually disagree that elderly people are not able to do physical activities. There is a lot of physical activities that they can do. It again depends. So they may have a special attention if they have a bad back, so we may have to have support, but we can still build the muscles overall. So we
provided
can,
Dr. Varkha they do, but they don't do. That is the problem.
yes. So they, like when they intend to be on this, the first thing we tell them is you do need, even if you can't do weights, you can do your body weight exercise. So I disagree an elderly person cannot do an exercise because they can even do any type of exercise. It's just the willpower. They need to be able to get the willpower to do it and start from scratch.
So, as a doctor, you would not prescribe Ozempic if the patient is not ready to exercise.
Agree. Because of the effects
Muscle
of
loss.
it, where they will keep losing their muscle mass when, as an elderly, their muscle mass is already reduced.
Yeah,
So the aches and pains that an elderly individual actually experience is because their fat mass has increased and their muscle mass has reduced.
right.
If you see a lot of people humping, like they develop spine issues, that's also because their muscle mass has reduced.
Correct.
So if they're not prepared to build up their muscle mass, I would honestly be reluctant to start them on Ozempic.
So we have some questions now. We are going to use questions that our participants are sharing. So,
Before Poonam, may I add on the other side effect of this, the Ozempic is also if you have a gallbladder stone,
hmm,
that is underlying, you need to be extremely cautious with this Ozempic. So that's the other adverse reaction that everyone need to know, because it increases the likelihood because of the reduced movements, it increases the likelihood for this gallbladder stones to actually block
oh,
the tube. So it increases the
That's what
likelihood
we have
for
noticed.
having an issue with the gallbladder.
right, terrible. Another new vision loss, and now you're talking about gallstones. Yeah, it's
Yeah.
not
So
not everything's rosy.
So we
Yeah.
are hearing more of it because a lot of more people are using it, especially in the Western world. All these actually, I'm getting the data from the Western world because a lot more people are using it compared to the Asian population.
Is hair fall also a side effect of taking Ozempic?
Hair fall is an impact. It's not a direct impact, but it is a late impact because of the nutritional impact. So
Oh,
yes, with Ozempic, they do not want to eat a lot. And if they do not eat the right nutrition, obviously hair fall is an impact of not taking a sufficient nutritional diet.
so is
And
Monjaro?
they end up in having less nutritional food, no micronutrients. They don't get it because you eat small, it stays. So the macro and micronutrients both lack. And finally, if you say, Poonam, that there is any hair loss or skin problem or anything, it is going to happen because as it is, we are eating less, and then where are the micronutrients? So we need to sometimes supplement them also.
Right. I think you're absolutely right, Geeta, about micronutrients and having the right nutrition. So is Monjaro the same as Ozempic?
The
It's
Mounjaro
different.
actually has
Manjaro,
double impact.
yes, it has double.
Yeah, it's not,
It
so
takes care of.
Mounjaro Zepbound is actually not available yet in Indonesia. So it has it actually is much more effective in weight loss because it works on two different pathways
Okay.
compared
Yes.
to the Ozempic. Mhm.
Geeta, you were saying?
Yeah. It's the same thing because it works on two things. One on the glucose levels, another on the satiety level. So
Okay.
people who are really dealing with a lot of blood glucose issues and diabetes, of course, you might be needing to prescribe Manjaro also. But the basic drug for weight loss and some part of your glucose is Ozempic, which is now very, very popular. It works, they both work differently, but ideally, the only two works. One is diabetes, one is overweight. I mean, obesity. This is that we deal with it.
Right.
But coming to
So,
the bottom line, you have to deal with good nutrition, whether you are on Ozempic or not. So there is no magic. There is no magic. You have to prescribe yourself a good diet routine, where you have macro and micronutrients both, high protein. How much ever it is challenging to have high protein, we can still take it from the home. And also, as Dr. Varkha said, that you have gout. Again, when you are just blindly going on high protein diet, you definitely will have gout. And of course, sometimes it changes into osteoarthritis, again leading to another problems. So the best thing is do the correct diet, whether on Ozempic or not.
okay, thank you, Geeta. So, there's another question: is Wegovy more for obesity and Ozempic for diabetes type 2? How do you differentiate which one to prescribe?
So Wegovy and Ozempic are actually both the same drugs.
Okay.
But this was released initially in the US, FDA approved. So it's again based on the insurance purposes. So the Ozempic is covered by insurance if the person has pre-diabetic or diabetes.
Okay.
But Wegovy has been released for overweight, but it can be interused simultaneously. It's more basically for insurance purposes. And the Wegovy actually in a pen has a higher dosage formed compared to the Ozempic. So again, it's a matter of choice with the discussion of your physician.
Right. Geeta, this question is for you. Our dals have a lot of carbohydrates. Is Greek yogurt, tofu, tempeh, and paneer sufficient for vegetarians for high protein? How do we count how many grams of protein intake we need in a day?
So, yes, you're right. As you said, tofu, tempeh, Greek yogurt, and these things for vegetarians are high protein. You have to inculcate in your diet for sure. Sorry, what was your question? What was, because your volume is,
How do we count how many grams of protein do we need in a day?
no, no, I think my band is not good. Please again repeat.
No worries. How can we know how much protein do we need in a day? How do we measure?
How much protein do you need?
Hmm.
No, as we said that ideally one should need 1 gram for 1 kg body weight, and none of us do that. That is true. That's why people stick to their protein powders and other things so that they can meet their diets. I would also suggest this, that when you are on a Ozempic diet, then you can actually go up to 1.2, 1.4 a gram of body weight for your this, because you have to have good muscles to continue with that. That's how, Poonam, we prescribe those homemade protein powders made with dry fruits and seeds, because they increase. Simply, you should have a simple dry fruit powder with your Greek yogurt in the morning. How about this? Your protein is increased in your body. The same way, we can have few more hacks so that our diet. I'm sorry for the low band here. So the diet has then high protein. We have to do this. You cannot depend on protein powders. Believe me, my not one, but many patients are now dealing with gout and high uric acid, which is
Correct.
another issue. And
Oh, very
especially
sad.
if somebody is obese, then it's still worse, because it does not let you do physical activities also.
Right. Understood. So, Dr. Varkha, there's a question from Simran. Does Ozempic increase silent cancer? Which studies
So
have thyroid cancer?
So Ozempic actually does not increase the thyroid cancer. However, it is contraindicated in any individual who has a history of thyroid cancer, or even a family history of thyroid cancer, or even a neoplasm syndrome.
Hmm.
So there are certain conditions that it worsens. So
Oh,
if you have an underlying thyroid cancer, or if you have a family history of thyroid cancer, none of the doctors would put you on the semaglutide.
right.
And or if you have the MEN syndrome, it's a neoplasma syndrome. So how it works, we still don't know. But what we know is that giving these patients Ozempic definitely has worsened their thyroid cancer condition.
Okay, understood. So there's another question from Dilip Raghavan. He says, from the conversation here, what I understand is that Ozempic speeds up losing body weight. My question here is, doesn't the recommended diet with regular exercise alone help reduce body weight but slowly? Yeah, Dilip, this is what we've been talking about all this while. It is about getting to lose body weight, losing weight for medical reasons. Maybe you are overweight, maybe somebody has a backache, maybe they are not able to exercise, and sometimes weight loss through regular diet and exercise can take a long time. It can take 6 months to a year. And with Ozempic, you can start seeing the results in 4 weeks, 4 to 6 weeks. And would you like to add to this, both of you, Dr. Varkha? Would you like to add to this?
Uh, so again, it depends on the indication. If you're just losing small amount of weight, your BMI is between 25 till 27, you really don't need Ozempic. You have time to actually go on the natural lifestyle changes. But if you have a medical condition, your time is limited.
Yeah.
So you don't want to develop a condition before you work on your lifestyle changes. So again, it depends on where you are at that stage.
Right. Geeta, what do you think?
That's what Dr. Varkha is right. If you are simply little overweight, of course, there's no need. Then again, where's the willpower? Will tell me the patients I have, as we all say, eat this, eat that, nobody wants to listen. They just want something like which is like a magic. So if you encapsulate the correct lifestyle, the right diet, the right protein amount, the right water amount, believe me, you can be away from everything. But people who have already gone through a lot in life and they are obese for so many reasons, of course they have to consider Ozempic under the doctor's guidance. But remember, the right diet is absolutely very important, not to increase your symptoms of vomiting, diarrhea, etc., intolerance, food intolerance. Correct. When you're on an Ozempic diet, take a correct diet. Take a correct diet so that it actually works successfully. And as Dr. Varka said, then you can taper and stop. You can, but your diet and lifestyle and your weight training should be very, very important. We do those special face yogas for Ozempic people because they are losing, but at the same time, they need high protein. This has to be considered that the high protein gets in your body, and at the same time, you're expelling your energy by doing weight training. This is very, very important.
Thank you. My question is, this whole topic has been about Ozempic versus diet. What is healthy? So my question is, what is healthy? What is healthy, Dr. Varkha? Geeta,
Okay.
what is healthy?
Health is a choice for, like this is my opinion. Health is a choice. Health is wealth for everyone. We all know that. But that is a choice for the individual. So, yeah.
Geeta, your call.
So being healthy is one thing is very important, that you should not have any diseases. That's very healthy. So you have to take care. You're eating well. Again, I'm coming to the same thing, that if you have blood pressure, you must eat less salt. Same goes with diabetes and the sugar. If you have got any issues with your heart, then you have to be on a low fat. When you are on a low fat diet, then the the fat is very important. One is the better fat, which is like comes from the coconut and ghee and everything. The other fats are from oils. These small things have to be taken care. One small thing people don't take care, that they don't drink enough water. So now tell me, how will the body work? How will the body work if you're not going to take enough water? That is one of the main things. The electrolytes have to be maintained, and then we try to give them the coconut water, etc. So remaining healthy, you have to take care of everything, all the nutrients, including even the drinking of water and the time of sleeping. Believe me, Poonam, stress is one of the very big reasons for obesity. So being healthy is being non-stressed. It's not possible, I know. But believe me, we can do small things in every field to come back to a full nutrient-rich body. It is not difficult, and it is not impossible. Sometimes small hacks make a very big difference. Diet is most important thing, I feel.
Yeah. So, thank you so much for this wonderful clarity on Ozempic, on weight loss, on a healthy lifestyle, on eating well, the right nutrients, the right nutrition. And I think this has given clarity to our participants that whether we should get into the trend, the fad of losing weight quickly through these weight loss drugs, which are actually not weight loss drugs but more drugs for diabetics, people who have a medical condition, to support their medical condition rather than look at it as a quick fix to weight loss. And whatever you do, whatever choice you make, please talk to your medical professional, talk to your health professional, before getting onto this journey. Do not try and take it on your own. Don't try to take it through somebody, just a prescription like that. And this is something that I was discussing with Geeta when I met her last time, that on any such thing where you need to do, whether you're sick and you are on a health journey, or whether you are looking at a weight loss journey, whatever you need a team around you. Don't do it by yourself, because then you are like swimming in the dark. You need
Actually,
your medical professional to be there to give you the right advice. You need your fitness, your personal trainer to help you train better. You need a dietitian, your nutritionist to give you the right food plan. And you also need a good friend with whom you can vent, to tell them, so that you are not stressed. So it's a holistic thing. Weight loss is not merely one thing, it is everything. So I hope this has been useful to each and every one of you. Thank you so much. Thank you for joining. Thank you, Dr. Varkha. Really appreciate your time and your sharing. Thank you, Geeta. As always, you have given a very nice perspective to this.
Poonam, you should create a Indo-Indians team for such things, where people can have all these facilities together.
We will do that. Thank you so much.